Hello everyone, welcome to Thriving, where we are dedicated to giving you the best information to not just live your life, but to thrive at it. I'm Dr. Danielle Joubert from Strive Rehabilitation Services, and I'm here today with Dr. Kaz from Anasa Personalized Medicine. She's been practicing as a naturopathic doctor for 8 years now, and she decided to open her own practice 3 years ago to help people achieve their optimal health. Thank you so much for joining us today.
Thank you so much for having me. I'm excited to be here.
Yeah. You know, one of the main focuses of our conversation today is menopause and how to help women who are starting to transition into that perimenopause stage and that menopausal stage.
Yes.
And as a doctor, a naturopathic doctor, you have a lot to offer to help these women with that transition. So we're honored to have you with us today.
Thank you so much.
So tell us a little bit about what a naturopathic doctor is.
Yeah, it's a great question. I feel like a lot of people don't know what a naturopathic doctor is. So we get our bachelor's degree, and it's a 4-year postgraduate program, and we have 2 board exams that we have to complete to get licensed. So we're holistic practitioners that treat all ages, and our goal is to treat the root cause to disease. And we do that by doing a lot of different functional lab testing, and we use only natural therapies, including herbs and supplements and dietary and lifestyle changes. So our goal is to treat the root cause and get people achieving optimal health.
That's wonderful. Why would someone choose a naturopathic doctor over a primary care physician?
So it's always important to have a primary care physician. In Rhode Island, we're not considered primary care, but I think a lot of people come to us because they want to be listened to and heard. So a lot of patients that come to see us see a lot of different specialists and still don't have an understanding of what's actually happening to them. So our first patient visit is 75 minutes. So we spend a lot of time with patients to really understand their whole life, all of their symptoms, what else is going on. So it's more of a holistic perspective, and it's good for people that want to use more natural support in terms of trying to avoid medications, or maybe they're having side effects to medications. So we try to use all natural support to help them
get to the root cause, which is really wonderful.
Yeah, absolutely.
So tell us a little bit how you define menopause.
Yeah, so menopause is a natural process that all women eventually go through.
All women have to go through it.
Us, yeah, at some point we're all going to be there.
Yeah.
But that's when the end of menstrual cycle. So that's it's officially when you no longer get a period after 12 months. So a lot of times women they won't have a period for 11 months and they'll get another period. So they have to reset and count all over again. So it's officially when your period stops for 12 months.
12 months.
Yes.
And how would you define someone who's starting to enter perimenopause?
Yeah, so perimenopause can start up to like 10 years before that. So the average age for menopause is around like 50 to 52, but perimenopause can start even like 10 years before then, so like early 40s. So that's when you start to have more symptoms, when your hormones start to decline, like the estrogen and progesterone, so you can start to be a little bit more symptomatic, like maybe hot flashes or night sweats or mood changes, some period changes. So that's when the hormones start to decline.
What are some common myths that you hear about menopause that you think need debunking?
Yeah, that was a really interesting question. I think one of the main things is that a lot of women think it just happens overnight, like it happens suddenly. So like I said, it usually starts at least 5 years before, but it can happen a little bit before then when the hormones start to naturally decline. So it's not like one day it happens.
Yeah, you just wake up and you're like, oh, okay, I'm menopausal.
Yeah, exactly. So it does take some time, so it doesn't happen all of a sudden. So it's more of like this slow progression over time. And then I think the other thing is that a lot of women think it only happens in their 50s, but like I said, it can happen even earlier, like mid-40s. So I would say that it's a good idea to always ask your mom, or if you have an older sister, to ask when they went into menopause, because genetics do play a role. So typically you can kind of follow that timeline. So if your mom went into menopause early 40s, like your chances are a little bit higher for that.
That you're going to be in the same range.
Yes. Yeah, exactly.
Yeah. So what is a holistic approach to treating someone during menopause?
Yeah, so there are a lot of different options. So when we're meeting with a patient, we really gather all of the symptoms. We ask all the questions to see what's going on, because there's a wide variety of symptoms that can happen. So, the most common ones are hot flashes or night sweats, changes in libido, your sex drive. So a decrease with that, or noticing vaginal dryness, mood changes, irritability. But there can be some other interesting ones. So palpitations, some changes with your heart. And then also joint pain is a big one. So I'm sure you see that a lot.
Yes, joint pain and weight gain.
Yes.
Yes, we see that a lot.
Yes, the weight gain, I think, is probably the reason patients seek us the most.
Yes.
So I would say that is pretty a natural part of menopause, unfortunately. As your body decreases those hormones, you usually gain this little belly weight. So that's probably the hardest part, but there are a lot of natural supports. So there are specific herbs that can be helpful for that. I really love seed cycling. So it's using 4 different seeds in your cycle to help to balance the hormones. So that's a really great support.
That's a really great support.
Yeah.
What happens if somebody doesn't have a regular cycle? How would you go about with the seed cycle?
Yeah, so we usually follow the moon cycle. So the moon cycle is 28 days, which is a normal period cycle. So we usually follow that. So with the new moon and the full moon, you usually change the seeds.
Okay.
It can help a lot with the symptoms.
That's great to know.
Yeah.
And how are your treatments different than conventional treatments?
So in conventional medicine, I think, unfortunately right now, a lot of gynecologists or even primary care, they don't know too much about menopause, or they don't have a lot of treatments. I would say it's becoming a little bit more studied right now. So there's more research out there. So there are some minimal treatments, like there are hormone replacements that I think a lot of gynecologists always err on the side of caution with. But there's so much new research that the risk factors are pretty low if you don't have a history or family history of breast cancer or other hormonal cancers. So usually in the conventional world, it's usually hormone replacement, but they usually are treating the symptoms. So if you have depression, they're going to give you an antidepressant. If you have palpitations, they'll probably refer you to a cardiologist. So there's no really great support, and I think that's why a lot of women are seeking something alternative.
Right.
So
getting to the root of the problem versus treating the individual symptoms.
Yes, absolutely.
Yeah.
And I think the lab testing is really important. So what I find when patients come in with their lab results, they don't test too many hormones.
So can you tell us a little bit about what a normal lab test would be for someone that's going through menopause?
Yeah, so normally when gynecologists are testing the hormones, they just test the FSH, which is a follicular stimulating hormone. So when that number is elevated, they're going to tell you you're in perimenopause or in menopause. So it kind of gives us an understanding of where you are, but what's more important is to see where the actual hormones are, where your estrogen levels are, where your progesterone is, where DHEA is, which is a precursor to your hormones, so kind of getting the whole picture of what's actually happening.
So you like to go in and test everything, not just the FSH?
Yes, absolutely.
Yes, yeah. Which would make sense, because that would be helpful to know.
Yeah, it's important to get the whole picture rather than just one little snapshot. Also, it's really important to go on a certain day of your cycle. So if you're having irregular cycles, it's a little bit more challenging, but if you're still having somewhat normal cycles, it's important to go on a certain day. So usually we test day 3 and day 21 of the cycle. So that way we can see what's happening during your period and then what's happening later on in the cycle.
Okay. And what is a bioidentical? Because you hear that term quite often.
Yes. Yeah, so bioidentical hormones is something that naturopathic doctors can use, or functional medicine practitioners can use. So it's basically, it's coming from an herbal source. So sometimes they're using from yams or from soy. So these are phytoestrogens, so they mimic how the hormones work in the body. So it's a really great option as an alternative to getting hormones directly.
Okay.
So it's more of a natural support that mimics, the estrogen or progesterone levels.
And do you think menopausal symptoms are normal and just a fact of life, or do you think somebody that's starting to have menopausal symptoms such as hot flashes or night sweats should seek some treatment?
I think it really depends on how severe the symptoms are. I would say yes and no. Just like when we all have our period, like some symptoms are to be expected, but we don't want anything that's very severe. You don't want severe cramps. You don't want severe heavy bleeding or breast tenderness or headaches. So typically, not all the time, but what we see is that women that have more challenging periods throughout their life are going to have a little bit more challenging symptoms during menopause.
Okay.
So I would say yes, it's somewhat normal, but we don't want those symptoms to be severe. So if it is affecting your daily life, you should treat it.
You should treat it.
Yeah.
Yeah. I think a lot of times women suck everything up and we just push through and we go about our day thinking it's fine, it's normal.
Right.
But we should actually take a step back and say we could feel better.
Yeah, absolutely. It's just about feeling your best self.
Yeah, you don't have to accept feeling like crap all the time because there are alternative medicines that can help you.
Yes, absolutely.
Yeah. And what are some of the specific herbs that you use or the supplements that you recommend?
Yeah, so it depends on, what's going on with the patient. So that's the other benefit of naturopathic medicine, is very personalized. So that's why I chose that for the practice name, Anasa Personalized Medicine, because every individual is so unique. So yes, as a woman, you're going to go through menopause, but you might have very different symptoms than somebody else. So it really depends on what your symptoms are. But there are certain herbs like dong quai and black cohosh, even primrose oil. There's a rhubarb extract that's really amazing for hot flashes. So those are some of the really great herbs.
Yeah.
And also, it is helpful if you are noticing in your 40s some symptoms to kind of get ahead of it. So that way you don't have more severe symptoms later on.
Right. So what you're saying though too is if it's working for your friend, it doesn't necessarily mean that's the right fix for you.
Yes, exactly.
Yeah. Because women, they tend to do that. Your friend tries something and then you would try it, but it might not be the right one for you.
Yeah, exactly. You want to find out what's right for you because you might have something else going on with your health. You might have a different health history, so there might be something better for you.
Yeah. So I work with women all the time during menopause for a variety of different reasons. Weight gain, bone health is huge, joint health also. But the number one question that I get asked is, how much protein should I be eating every day?
Yeah, it's a really great question. And I think that's a really important question. So in our intake, we talk about nutrition. That's a big focus for us, is how to support and change your diet, to support yourself the best. So we'll do a dietary recall. What I find is most women, I would say most people, don't eat enough protein.
In general,
in general,
especially just all ages.
All ages, but especially at breakfast. But I would say, in general, for most people, like a minimum of 60 grams of protein is a good kind of starting point.
Okay.
It depends on your body weight, so there are certain calculations, but normally I recommend like 60 to 100 grams of protein, depending on what your goals are, your weight loss goals, if you do have osteoporosis or osteopenia, or if you want to work on building muscle mass, which is really important during menopause.
Really important.
Yes,
absolutely. So I think then they should start by calculating and seeing if they're under 60, they've got some work to do.
Yes, exactly. I think just starting at baseline, because I think a lot of people don't even reach 60 grams of protein per day.
Yeah. It'd be interesting to see if they calculated what they would come up with.
Yes, yeah. So I think most people, when we're doing a dietary recall, their breakfast is usually carb rich. Maybe they're eating a piece of toast, maybe they're having oatmeal or cereal, yogurt sometimes, and sometimes eggs. So starting with more of those protein rich, like the yogurt or the eggs, is going to be a better option.
Yeah, great.
Yeah.
What are some of the trends that you're seeing in holistic treatments for women in menopause?
So I think in holistic medicine, a lot more people are leaning towards the bioidentical hormonal support. So there are a lot of different options for that. So there are like topical creams, there are patches, and there are also pellet therapy. So naturopathic doctors have a different scope in each state. So in Rhode Island, we don't have prescriptions in our scope. So the pellet therapy or the bioidenticals is considered like a prescription. So we're not able to prescribe that necessarily in Rhode Island, but we do refer to other practitioners that can provide that.
Okay, that's great to know.
Yeah.
And what are some common questions that you receive from women who are going through menopause?
Yeah, I think the big one is, can you help me?
Yes.
I have all of these symptoms. Are these normal symptoms? And can you help me? Like, I've gained 20 pounds. I, feel so fatigued. I have brain fog. I'm just not happy anymore. My shoulders hurt.
Sleep.
Now I can't sleep.
Yeah.
Sleep is another big change.
Yeah.
And it's interesting, as your hormones decline, melatonin, that sleep hormone, tends to decrease for perimenopause or menopausal women. So that's a really important thing to test as well. Yeah.
Well, thank you for joining us today on Thriving. And don't forget to subscribe to our YouTube channel or our Facebook page for exercise tips. And we hope to see you out there living your best life.